recording of this panel's question and answer session can be found on the Duchesne County School District website. You can also find this session separated into specific topic clips connected to your questions, concerns, or interests on the D.C.S.D website at www.dcsd.org. Much discussion and preparation has gone into our plan to return to school where learning is optimized. We realize the need for students and teachers to be back in school this fall and have been working towards that goal throughout the summer. When they are in school, children benefit from important routines, structure, and support services. Our students look forward to being together with their friends and teachers. Teachers look forward to being together with their students and friends as well. And parents are counting on a return to normalcy so they can provide for their families while having the peace of mind that our school district is doing everything it can to provide safe, healthy learning environments for students. An added factor that needs to be mentioned relates to a bit of a trade-off relating to adhering to established guidelines and participating in school-related extracurricular activities. We are excited to return to school and enjoy face-to-face learning, as well as the extracurricular opportunities that are an integral part of the learning experience. To maintain these opportunities, it will take a joint effort from students, teachers, coaches, parents, and community members to follow important guidelines in order to maintain a healthy environment. In other words, if we fail to keep the coronavirus in check, these opportunities may not be available to us. We encourage each of us to do our part to maintain safe and healthy locations for our students to participate and learn.
All right, we want to welcome our part 2 version of our communication efforts to allow employees and parents and community members a little bit more detail and information regarding our COVID-19 procedures and the way we're going to try to keep kids safe this year. My name is Mike Ross. I'm the Student Services Director. To my right, I have Scott Forsythe, Vice Principal at the Junior High in Roosevelt. To his right is Jesse Fieldstead, the Vice Principal and Athletic Director at Union High School. To my left is Michelle Bostic, Principal at Roosevelt Junior High. And to her left is Bruce Guyman, Principal at Centennial Elementary School. So we'll just go ahead and start asking the panel some questions. We'll get right to it. So Mr. Forsythe, to start with, we're going to be using words and terms that need defining. Will you define what the terms quarantine, isolation, close contact, and contact tracing mean?
Absolutely. So first of all,
to be quarantined means that you stay in your home for 14 days so that you don't go around other people and get other people sick without even knowing it. You may not have any symptoms. You may be asked to quarantine for 14 days if you had an exposure to COVID-19, and this means you were in close contact with someone who had COVID-19. When you first get an exposure, you may not have symptoms for 2 to 14 days after the exposure, so it's important that you quarantine as quickly as possible after your exposure so that others do not get exposed to the virus. To isolate means that if you've tested positive for COVID-19, you need to stay in isolation, which means you stay by yourself, and the only time you leave the home is if you need to seek medical care. Close contact, you're going to hear that word a lot with the school year coming, and that means that you were closer than 6 feet to someone who had COVID-19, and you were in close contact with them for more than 15 minutes. Contact tracing is what we're going to use in the school district for school activities. If someone has an exposure to COVID-19, we are going to contact trace. That means we're going to find anyone that had close contact with that student while they had COVID-19. So we're going to trace them and find them and then inform them through a letter that they had a close contact with COVID-19. And then if it's a school activity, we will trace them. If it's not, then Tri-County Health will trace them down.
That's right. Thank you very much. So in summary, the state has published their COVID-19 manual to help us with these things. Everyone who lives in your home should quarantine for 14 days if someone in your home tests positive for COVID-19. Students are not to go to school until the 14-day quarantine is over. Working with the school principal, the student may continue to learn working with the teachers through online learning using Canvas and may explore other learning options available at the quarter break. All right, let's go to the next question. One of the biggest concerns with COVID-19 has to do with face coverings. Mrs. Bostic, what are the requirements regarding face coverings?
So under Governor Herbert's mandate, all students, staff, and visitors will be required to wear a face covering. This face covering can be a mask or a gaiter. We are asking parents to provide face coverings for their children, but if the student loses or forgets his or her face covering, one will be provided for them. Face shields may only be worn without a face mask when the ability to see the mouth is essential for communication, including for an individual who is deaf or hard of hearing, or while participating in speech therapy.
Thank you. Mr. Guyman, will there be any exceptions to the face covering directive?
Couple things. One that I wanted to add to what Mrs. Bostic said is one thing the governor did address is for young learners, if they're learning basic reading skills, a face shield may be appropriate and needed to help there. But also, if a student has a health-related need or a disability-related need or exceptional circumstance, there is a form available in each school that a parent can obtain that's signed by both the parent and the healthcare or licensed mental health provider to document what that need is that allows them to not use a face covering while at school.
Thank you, Mr. Guyman. And those exemption forms will be at each of the schools around the district. Next question, Mr. Philstead. For us to wear face coverings at school, is it a law? And what if a student does not qualify for an exemption, refuses to wear a face covering?
So that's a good question. The face coverings are a requirement, a temporary measure while we wait for the vaccine to be developed. Masks are our medicine for right now. They have the best chance of stopping the spread of respiratory output from one person to another. And we must remember that this is an order and it has the same authority and force as a law during this time it is enacted. The order requires all students, staff, and visitors to wear masks, even if they are in attendance to a sporting event. As face coverings are required, if the student does not follow one of the outlined, if the student does not qualify for one of the outlined exemptions, it is assumed the student would not be allowed on the bus or to be physically present in school. This exclusion will last until the public health order expires or the student decides to begin wearing a face covering at school.
Thank you. This is a critical element of our face covering guidelines, I think. When we're asking, and I know I have great confidence in our school administrators, they're going to do everything that they can to help resolve any concerns with face covering issues. Students aren't required to wear those masks, but we want you to communicate with the school principal and teachers so that we can resolve those conflicts. Now, Mr. Forsyth, you are a former band teacher. How do you foresee face coverings working for elective classes like music, art, shop class, and PE?
Sure. Excuse me. Most teachers that teach elective classes have multiple spaces of different sizes. So, for example, in the band classes or choir classes, students may start in the band room or the choir room and then move to the auditorium where they can obviously space out more and they can adjust their face coverings and those things for what they're doing. Band obviously is going to need to remove face coverings while they play their instruments, but while the teacher's instructing or giving a lesson, those face coverings can be worn. Shop teachers, they have classrooms and they have a shop, and so they'll be in a little closer quarters while they're in the shop, and then move to in the classroom, and then they can move to the shop where they're a little more spread out. And then PE teachers may choose to take the class outside or go to the gym, and then we'll maintain social distancing when it's possible, and if it's not, we'll just make sure that they're following face covering guidelines. And classroom seating charts are going to be extremely important. And as I mentioned earlier with the contact tracing, we're gonna need to have seating charts so that we can trace those students and know who had close contact with those students.
Thank you. Next question has to do with transportation, and I'll answer that. The question reads, will the students who ride the bus be required to wear face coverings? Yes, students will be required to wear face coverings on the bus, especially because when the bus starts to fill up, true social distancing will be difficult to achieve. So we have a few things that we're asking our drivers and our students to do. Our drivers will be wearing face coverings and gloves. They will also maintain a seating chart. Drivers will also ask students to sit in proximity with family members. So we want family siblings to sit together in close proximity on the bus. The seating chart and the familial seating assignments will help with contact tracing. The face covering exemption form also applies to the bus as well, and as well as school, and will be valid through the efforts of the family and school principal. All right. So in summary, we are asking students to wear face coverings at school and on the bus. If the student loses or forgets his or her mask, one will be provided. An exemption form is available for qualifying and unique health concerns. Parents whose children have IEPs, 504s, or health care plans, please speak with your child's SPED teacher or the school principal. We do remind students and parents that school dress codes are still in force, having to do with logo or decoration use on face coverings. And as I mentioned before, administrators are going to do everything they can to help resolve concerns, and please speak with them as we begin the school year. All right, next question. Mrs. Bostic, what happens when a student becomes sick at school or on the bus?
Some students may get sick on the bus or when they are at school. Students who display symptoms of COVID-19 will be isolated from other students, teachers, and employees. Parents will be called to pick them up and take them home. The health department will be notified.
So in summary for that, procedures for students with COVID-19 symptoms will be identified, and students will be isolated until a parent can pick them up. Thank you. Mr. Guyman, can you give us a little bit more detail about recess and how that will play out?
Yeah, this past week, all the elementary principals, we were talking, and we all agreed that this year, more than any other year, school needs to be fun. And recess is definitely a big part in an elementary school of school being fun for students. One thing that we have done is we've looked at all of our procedures for recess and other activities, and looking at what we can do to maintain or increase health and safety of our students. For example, all of us are going to be staggering our schedules, where maybe instead of 2 grades or 3 grades being at recess at one time, there'll be just 1 grade. We have an extra kind of level of kind of disinfecting and sanitization of recess equipment that'll happen throughout recess after each grade level or each group that's out there uses that equipment. We're going to have different activities that our students may not be used to that allows them to spread out and social distance a little bit better. And just really looking at what we can do to still make things fun, but increase that social distancing and safety of our students. We're also going to ask that students sanitize and wash their hands before and after recess, after leaving the classroom and before returning to the classroom. And we feel that recess will still be fun and a great part of elementary school, but we can make it safe using some of the procedures we put in place.
Thank you for explaining that. And I'll add a little bit in summary. Parents, please be patient as your students and your children come home and discuss with you their day. What happened last year at recess, what happened last year at lunchtime, what happened last year in the school setting in classrooms will probably be much more different this year. And so have those discussions with your children, and please encourage them to be positive as we try to work through this. All right. Next question. Mr. Philstead, let's talk a little bit about extracurricular and athletic activities, shall we?
Yeah.
Okay. We're looking forward to the return to these events. Our community is a great support throughout our district schools. In fact, a lot of our sporting and athletic events have already had competitions and contests, so we're already it's already begun.
Good.
Let's go through a scenario where one of our students at one of our schools is tested positive for COVID-19.
Yeah, so just a note on that, our soccer team's already started. We've hosted a couple of competitions, and we had a football game on Friday. So coming up, we have a big event where we have a volleyball team that's hosting a tournament, and we're asking people to make sure to wear their masks when they're inside the building. But let's say that a soccer player tests positive for COVID-19. She will be placed in isolation at home, as we've talked about, which means she can't go to school or participate in school soccer until her symptoms start to get better. And she has been fever-free for 24 hours without medicine, and it has been at least 10 days since she had symptoms or tested positive. The health department school, after investigating, will contact all those who have been potentially exposed in close contact with the soccer player and those who have been identified as high risk. Those students will be quarantined for 14 days, and family members of the positive soccer player must be in quarantine for 14 days as well. The students who are exposed or in close contact with the student that tests positive at school or soccer practice should quarantine at home for 14 days from the date of the exposure. Students who are quarantined should not go to soccer practice during the 14-day quarantine. The students' families do not have to quarantine unless the person who was exposed at school or at soccer practice tests positive for COVID-19.
Thanks for explaining those details and guidelines. You know, it's important for our students and coaches and our families and community to take precautions and follow the guidelines we've been talking about. We want you to social distance, we want you to wear face coverings, and we want our students and employees to report when they feel the symptoms of COVID-19. If we fail to limit the number of COVID cases, contests and competitions may be postponed or even canceled, and that's something that we really want to try to avoid. All right, Mr. Forsythe, what can parents and school personnel do to promote a healthy environment at school?
Sure. First of all, we want parents to be aware that they need to monitor their child's health. I know it's pretty tempting in the morning if a child wakes up and says that they don't feel good, or they might be a little anxious about something at school that day, that they feel sick. But other years we've kind of just encouraged them to come to school and they'll feel better. But this year we want them to stay home. If your children have a temperature or they feel sick, we want them to stay home. Once they get to school or on the school bus, school personnel will be monitoring students and checking them for symptoms. If a student comes down to their teacher or to the bus driver and says they don't feel good, they will be brought to an isolation room at the school where parents will need to come and pick them up. And we'll need them to be picked up as quickly as possible. So parents may need to be available during the school day to come and pick up their students if they become sick. And we want students to be able to go to their teachers and talk to their teachers about not feeling well and being able to come down and get sent home. So just make sure that if your kids are feeling sick, they stay home that day and don't return to school until they're feeling better.
Excellent, well said. I want to thank our panel today for coming in and helping out with this information session. We again want to encourage all of our community members, whether it's school or family or businesses, that they adhere to the guidelines so that we can continue our efforts in our academic classrooms and activities as well as extracurricular. Thank you again.
Changes relating to information we receive relating to these questions and answers and other COVID-19 issues have happened up to this point and will surely happen in the future. Please be patient as we try to communicate these changes regularly and effectively. We urge families to practice clean hygiene, proper hand washing for at least 20 seconds with warm water and soap before eating, after using the bathroom, after blowing your nose, coughing or sneezing, if hands are visibly dirty, and when returning home. At school, we'll ask students to practice the same hygiene as well, washing hands before and after recess and extracurricular activities. Students will also be asked to sanitize their work tables and desks, while our custodians will have consistent schedules of cleaning high traffic areas, classrooms, and recess equipment.